Now let's talk about basal cell carcinoma or rodent ulcer. It is a 4-marker question and I have taken my points from SRP. So let's see what are the things that you have to know to write a 4-mark question. Coming to the definition, what is basal cell carcinoma? It is a low-grade, locally invasive carcinoma that is arising from the basal layer of the skin or mucocutaneous junction. Once again I will tell, it is a low-grade and it is locally invasive carcinoma. Low-grade and locally invasive. It is arising from the basal layer of the skin. Basal cell carcinoma, so basal layer. There is squamous cell carcinoma, so it is arising from the squamous layer of the skin. It is a basal cell carcinoma, it is arising from the basal layer of the skin or mucocutaneous junction. And it does not arise from mucosa. That is a very important point. It does not arise from mucosa. And it is the commonest malignant skin tumor. SCC was second most common tumor. Here it is the most commonest malignant skin tumor. More common in white-skinned people, and it is common in places where the exposure of the UV light is more. For example, Australia. So I think this part is clear. It is a low-grade, locally invasive carcinoma that is arising from the basal layer of skin or mucocutaneous junction, and it does not arise from mucosa. It is the commonest malignant skin tumor, more common in white-skinned people, and it is common in places where the exposure to UV light is more. Example, Australia you can write. Coming to other causes, the one of the most important cause that I have already discussed is UV light. Other causes, arsenic, coal tar, aromatic hydrocarbons, any other skin tumor syndromes, xeroderma pigmentosa, albinism. So these are the other etiological causes for developing the basal cell carcinoma. Arsenic, coal tar, aromatic hydrocarbon exposure, skin tumor syndromes, xeroderma pigmentosa, albinism. And it is more common in males, middle-aged and elderly. Even squamous cell carcinoma is also more common in males. Here basal cell carcinoma is also more common in males and it is seen in middle-aged and elderly. I think this much is clear. Now let's move on. It is commonly seen in face. Above, the line drawn between the angle of mouth and ear lobule. Here you can see in this picture. If we draw a line from the ear lobule to the angle of mouth, it is most commonly seen above that line in the face. It is called tear cancer. It is tear cancer. It is also called tear cancer because it is commonly seen in areas where the tear rolls down. So tear mostly rolling down. Here you can see in the left picture where the cancer is. So that is the place where most commonly the tears are rolling down. So that is why it is also called tear cancer. So there are so many names: basal cell carcinoma, rodent ulcer, tear cancer, etc. Let's move on. It is only locally malignant. It does not spread through lymphatics or blood. So it is only locally malignant. It is not metastasizing through lymphatics or blood, but it erodes deeply into the local tissues, including the cartilages, bones, and it will cause extensive local destruction. And that's why it got the name rodent ulcer. Like a rodent, it will destruct the local tissues deeply. So it is not a malignant, it is only locally malignant because it is not spreading through lymphatics or blood, but it will deeply erode the local tissues, including the cartilages, bones, like a rodent. So it is also called as rodent ulcer. There are different types. I think this is not that important, so that's why I just keep a pic of that. There are different types of this basal cell carcinoma: nodular, cystic or nodulocystic, ulcerative, multiple, pigmented, geographical or field fire, forest fire, BCC, basal squamous. You can just have a note about this, like what are the different types. It's not that important. Coming to the features. Ulcer on the face in a middle-aged man which is non-tender, dry, slowly growing, which is non-mobile, with raised and beaded edge, with a central scab, often with central depress or umbilication. This is the characteristic finding that we'll get in a basal cell carcinoma case. As we already told, it is most common in males, middle-aged. So a middle-aged man is coming with a non-tender, dry, slowly growing, non-mobile, with a raised and beaded edge, with a central scab, often with central depress and umbilication. It is basal cell carcinoma. And this basal cell carcinoma can be of low risk and high risk. So how to say it is whether low risk or high risk? If it is high risk, the size should be greater than, to the criteria to say it is high risk, basal cell carcinoma, the size, any of the following, the size should be greater than 2 centimeter. It should be near eyes, nose or ear. Indica thing you can tell. Near either it is near eyes, nose or ear. It is a recurrent tumor. It is having ill-defined margins and the person is immunosuppressed. So if any of these conditions are there, we can tell the tumor is high risk category. So you have to be worried. Now let's see what are the clinical pathological types. There, according to the shape, size, location and all, a number, we can classify different types. We are told multiple, nodulated, etc. So here, according to clinical pathological, again 3 types are there. They are superficial type, morphic type and fibroepithelioma type. The names you have to keep in mind and you can write in the examinations. You can just put it a heading as clinical pathological types. Superficial type is there, morphic type is there, fibroepithelioma type is there. What is superficial? Small buds of tumor masses. It is commonly seen in young individuals. Small buds, small buds of tumor masses, superficial type. Morphic type, dense storm with basal cells and type 4 collagen. It spreads rapidly. So morphic type is somewhat dense and with basal cells and type 4 collagen, it spreads rapidly. What about fibroepithelioma type? Elongated cords of basal old cells with meshwork common in lower back. So these are the 3 clinical pathological types: superficial type, morphic type and fibroepithelioma type. I guess it's clear. Let's move on. Differential diagnosis. As we already talked about in squamous cell carcinoma, the same, almost it is same. Instead of BCC, here we are writing squamous cell carcinoma, melanoma, keratoacanthoma. One addition is seborrheic keratosis. Spelling is wrong again, so just ignore that. Seborrheic keratosis. So these are differential diagnosis. Coming to the investigation part, wedge biopsy is done, CT scan is done and dermoscopy is done. Wedge biopsy and CT scan is same as squamous cell carcinoma. There we have done FNAC. Here we are not doing FNAC and MRI. Here instead of that we are doing dermoscopy. So investigation, wedge biopsy, CT scan and dermoscopy. Treatment. Like the squamous cell carcinoma, even basal cell carcinoma is radiosensitive. So if it is away from the vital structures, what are the vital structures? Eyes, ear. So those structures, if it is away from the vital structure, then we can attempt for the curative radiotherapy. So because the tumor is radiosensitive, radiotherapy is not given once it starts eroding the cartilage or bone. So if it is not eroding the deeper structures, then we can give the curative radiotherapy. But once it started eroding the cartilage or bone down, we can't do radiotherapy, curative radiotherapy. Coming to the surgery, the first choice is radiotherapy. But when to do surgery? What are the indications? If the rodent ulcer eroding into the bone or cartilage, that I have already told, if it is eroding the bone or cartilage, we can't do radiotherapy. So that is the first indication for surgery. And if the basal cell carcinoma is close to the eye, it is a vital structure, we can't do radiotherapy. So we have to go and do surgery only. And if it is recurrent basal cell carcinoma, after radiotherapy. Even after radiotherapy, if the basal cell carcinoma is coming, still we have to go for surgery. So rodent ulcer eroding into the bone or cartilage, basal cell carcinoma close to the eye, recurrent basal cell carcinoma after the radiotherapy. In these 3 conditions, we have to go for surgery. Now let's see what are the different various surgery options we have. One is wide excision with skin grafting. We have to excise the tumor and we have to do the skin grafting. Cryosurgery and MOHS, microscopically oriented histographic surgery. It is the surgery that is done in the skin malignant lesions. It is also, Morse is also a part of the scientist who discovered, his name also is there. And laser surgery, photodynamic therapy. So these are the names that you have to keep in mind while writing the basal cell carcinoma. So I think it's clear for you guys. I'll just show the picture of basal cell carcinoma. This is near the neck, one is near the forehead, like just above the eyes. So like this it will appear. So under these are headings and these are points that you have to write for 4 marker. So thank you for your time guys. See you again. Bye.